Melsa, thank you so much for joining me today. I'm really excited to learn
You're so
about acupuncture.
absolutely. I know. It's such a fun topic.
Yeah, so first, I think just get me started with the basics. Like, what is acupuncture in general? What is it?
I know. So acupuncture is the insertion of little tiny little needles into specific acupuncture points in the skin that have been mapped throughout the millennia on over meridians, energy meridians that run up and down the body. So there are 361 acupuncture points, and that's kind of an approximate 361 acupuncture points that run along 14 different meridians that run up and down the body. And so by stimulating these little acupuncture points, again, that have been mapped over centuries and centuries, we can have a homeostatic effect on the body, which means we're bringing the body back into balance, into its natural harmony.
Got it. Okay. And specifically, it seems like both of us know, because you are an IVF acupuncturist specifically, that acupuncture is very popular among women that are trying to conceive and then women that are actually going through infertility treatment. So, specifically related to fertility, how can acupuncture be beneficial?
Sure. So we acupuncture got on the map with IVF in the 2002 Paulus study that looked at
Mhm.
acupuncture right before and right after transfer, and it showed to be very beneficial. That study has been reproduced over the past 19 years now, very many times. And there have been meta-analyses that have been done on acupuncture and IVF, and it does show to be beneficial. What and some of those studies are a positive pregnancy test. Some of those studies are live birth. You just kind of have to, research can be a little bit complicated, but there have been some recent studies that again show that acupuncture is really beneficial. We're all about the circulation. It's all about circulation with acupuncture: circulation of blood, circulation of chi, circulation of both blood and chi in the meridians. And so, yeah, it's just they're like Western medical, like we can now look at ultrasounds of the uterine artery, of course, with the beauty of Western medicine, and look at, the uterine artery before acupuncture and after acupuncture. And really, it increases blood flow to the uterus and ovaries. And so that's kind of a more Western view of things, but really unblocking the chi in the blood that kind of flows through the pelvic region is what our jam is. And then also to calm stress, because everybody going through fertility treatments is, just completely stressed, because it is a stressful process. And studies have shown that acupuncture is really effective at reducing cortisol, which is the stress hormone. And so, we kind of like, especially when you're going through fertility treatments, you kind of are living in that fight or flight, that just kind of stressed mode all the time. And it really, really brings the body down to kind of that rest and digest. It stimulates the parasympathetic nervous system. So it really just calms everybody down. It's lovely. Everybody leaves my treatment rooms very relaxed and what I call acupuncture stoned.
God, that's funny. Acupuncture stoned. I've never heard that. Okay, super interesting. And yeah, I'm glad you brought up that study. I saw that one too from
Mhm.
Paulson from
Yes, yeah.
2002.
Mhm.
And then I recently saw that there was a meta-analysis done in 2013, I think, that included maybe 20 something studies with over about 5,000 patients that also showed that there is a statistical significantly improvement in live birth rate and clinical pregnancy rate as well. So it's really interesting.
It is. It really is. And, Western Med is getting on board. I have, and this is from the CDC data from like 2014 is when I kind of like analyzed the CDC data of the top, the busiest 50 IVF clinics in the country. And 50% of them either had acupuncture in-house or they had acupuncture listed, on their website. And so, it's coming coming around. IVF doctor, if you go in any of the IVF Facebook groups, you'll see, or if you Google IVF success, acupuncture will come up. And so, it's a popular adjunct to fertility care.
Yeah, it sounds like, and actually I was wondering, now that you brought up that some clinics mention that they offer this in general. I know that you work with a clinic a lot and to take care of their patients. In general, for most of the reproductive endocrinologists that you've worked with or spoke with, what's their general outlook on acupuncture? Do some of them say, like, in general, yes, do it? Do some of them say, like, it's really up to you, like it's a personal thing?
It's all of the above.
Yeah.
I think that for me personally, some of the doctors who I work very closely with are like, yeah, you're stressed out, like go see Melsa. Just go and just get some, just go and get some relaxation, like take it down a notch. And then some doctors are like, well, the research isn't really there. So, if you want to go ahead. I haven't met anybody that any of the doctors, at least here in San Antonio, that are like, absolutely not, don't go and do acupuncture, just because the research is there. And also, the patients are wanting another outlet, another way to increase their IVF success, so their fertility treatment success.
Right. Yeah. Because for a lot of people, it's probably something they feel like they can like take control of a little bit as well. As opposed to everything always being like done to you, whether or not you want it to be done. Like this is something where you can choose to do it and say, I'm going to go to acupuncture. I want to see if I can try to improve some blood flow and just like relax. And
totally.
Yeah.
And have another team, another person on your fertility team. You've got your doctor, you've got your nurse. Your acupuncturist is like rooting for you. Like we want you to get pregnant as much as you want to get pregnant, and as much as your doctor wants you to get pregnant. So like I strategize with all of my patients on the best kind of strategy going forward to maximize their fertility potential before going through IVF.
Awesome. So talk me through, okay, I'm probably gonna ask some really specific questions now because I'm like really curious. So walk me through like start to finish what it's like to actually get acupuncture done, like from like I arrive to come see you, what happens?
So, on our initial consult, my patients, my initial consult patients fill out an entire like detailed intake form. My top kind of 5 things that I want to know about my fertility patients going in, which helps me kind of know what to do with them acupuncture wise and come up with a Chinese medical diagnosis is, what are their periods like? What is their digestion like? How are their stress levels? What is their sleep like? And what is their body temperature? And those are, those kind of 5 things can kind of like morph into the conversation into like, oh, okay, well, is your stress causing headaches and jaw tension, or is it shoulder tension and IBS symptoms? How's your digestion? Like, are you having daily bowel movements, or are you like more on the loose side, or have you, are you IBS? Are you having IBS problems? I kind of want to see like where the inflammation is coming in their body. What is your sleep like? Are you having night sweats? Is it hard to fall asleep? Is it hard to stay asleep? Let's see, body temperature wise, like, are you freezing all the time? Are you somebody in South Texas that wears a sweater in August? Or are you somebody who keeps your air conditioner at 62, in November? What's going on in here? Because really with acupuncture and Chinese medicine, we look at the person as a whole. Western medicine is a little bit more compartmentalized, right? You go to the fertility clinic because you're having infertility stuff. You go to the GI, doc because you're having digestive stuff. You go to the migraine doctor because you're having headaches. But in Chinese medicine, it all plays into each other. And so, that's my initial consult. And then of course they get their acupuncture treatment. When they come back the following time, we'll just kind of go over like just a little brief, okay, what's going on, what's going on with you? Like if they're going through fertility treatments, like where are you in fertility treatments? How's your stress? Like what's happening? And then we'll come into the treatment room, and, they'll get on the table, which is right here. I'm in my office. They'll get on the table, and then, I'll stick needles in them. Typically about 15 to 20 needles. And this is just me. I mean, there are a vast number of practitioners that use more or less. Some practitioners use, 5 needles in an entire treatment. I'm more like in the 15 to 20 range. Typically the needles will go below the elbows, below the knees, some on the belly, and then I do some relaxation points, on the top of the head and in between the eyebrows. But if my patients come in with like headaches or allergies or, anything like, or constipation, anything like that needs like a few extra needles, then I'll just, I'll put a few extra needles in there. And then they relax with needles in for about 30 minutes. I've been a fertility acupuncturist for almost 8 years now. And the kind of the consensus, and this is actually how I experience acupuncture too, is that, you kind of go in between that like wake and sleep. So you kind of go into that theta state, which, you're kind of in that between wake and sleep. And then you can feel like a little pulsing sensation, a little like dull ache or throbbing sensation where the needles are. And you kind of feel a little floaty, or some people kind of feel heavy. Some people just pass out. Some people just like, they're like, oh my gosh, this is the best nap like of my life. So everybody kind of experiences acupuncture a little bit different. But, for the most part, it's just so relaxing. So
that's so interesting. Okay, this is good because you answered. I actually wanted to know like how many needles go into your body. Okay, so it depends, but like between 5 and 15, you would say, like if you went to an acupuncturist.
Yes. And, I mostly do the front. I mostly work on the front. There are practitioners that prefer working on the back, just because of the points, everybody has their favorite points. And so, but, again, this is just individual, but mine are between mine are between 15 and 20 typically. And this is a question that I get a lot. These needles are single use. They're sterile. They come in sterile packs. And then they get thrown in a sharps container, and we take that to the incinerator. So they're all sterile needles. There's no like autoclaving or reusable needles or anything like that. So that's a question that I get sometimes.
Yeah, that makes sense. That's actually really good to know, because I wouldn't have even thought to like ask that. So
Totally.
yeah,
Totally.
no, I'm glad that that's the case then. And then
Go ahead. So I have a little acupuncture. I have an acupuncture needle and a hypodermic needle, just to kind of show you the difference of like the size, because everybody's like, oh my gosh, does it hurt? My fertility patients are going, they're sticking themselves with needles left, right, and center. And so, the thought of actually like signing up for more needles is a little bit of a daunting, thought. But these needles are tiny, tiny, tiny. They're about the size of a hair follicle. And so if you can see, this is a hypodermic needle. And then this is an acupuncture needle. Well, let's see, you can't actually see.
Wow.
That's
so
the shaft.
Small.
Yeah, that's the shaft of the needle. And then there we go. You can kind of see it. They're tiny, tiny, tiny little needles. So they're nothing to be feared. You don't really feel them going in. Hands and feet are a little bit more sensitive, just because we have a whole lot more, structure in there. But if you're putting a needle in, the belly, or in, like a thigh or something like that, or a calf muscle, you really don't feel them. And if you do feel them a little bit, your practitioner can kind of adjust. Sometimes it'll be a little bit pinchy going in because I've kind of blown past a pain receptor or something like that. I can adjust the needles to and just like pull them out a little bit and redirect, and then it will be painless.
Got it. Okay, that's really good to know, because that's something I was curious about as well. Also, I was wondering, are you able to move at all when the needles are in? Do you have to stay really still?
Sure. No, you can scratch a nose or something like that. Like I wouldn't get off the treatment table, although that's happened to me. That's happened. But you know, I wouldn't get off the table, but yeah, you can scratch a nose, you can kind of adjust, you can, you know, move your leg if your leg needs, you know, needs an adjustment. But yeah, you can move.
Okay,
Yeah.
awesome.
Yeah.
And then I've seen some studies that talk about for acupuncture and IVF where the acupuncture was done during the controlled ovarian stimulation during taking the medications. But then I've also seen ones where it was just for the around the time of the embryo transfer on the day and then
Right.
maybe a couple days after. What do you recommend? When should people start doing the acupuncture?
You know, if I have like best case scenario, women come in about 3 months prior to retrieval. You know, the primordial follicle to ovulatory follicle is about a 90 to 110 day cycle. And so we're really wanting to, you know, influence the blood flow of that uterine artery 3 months prior to kind of hit those primordial follicles that will ovulate with ovarian stimulation 3 months later. Now, that's best case scenario. I have women who find me, you know, like right when they're doing stems, right when they're starting injections. I have women that find me a month before. And then I do have women that will come in, like who will call me, you know, and want a pre and a post, you know, that from the protocol from that Paulus study from 2002, that kind of people get a little bit attached to. I'm not super attached to those treatments, but as long as I can see women, you know, within a decent time frame, within 24, 48 hours of transfer, I will see women in the 2-week wait. And then I'll say, because I mean, that's the most stressful time, right? I mean, it's all stressful, but really like it's getting real in the 2-week wait, right? And so
Yeah.
I will see women in the 2-week wait and also in the first trimester, because acupuncture is really good for nausea, vomiting. You know, we can just, again, stress relief, that kind of stuff. So
Awesome. Oh, so it's a good all-rounder then.
absolutely. Everybody needs acupuncture.
Sounds like, oh, yes, that leads me to my next question. Is there anybody that should avoid acupuncture for any reasons or anything that people should know about that?
You know, not necessarily. You know, I have women who, I mean, most 99.9% of people love their acupuncture. They just love it. You know, there's that 1% or 0.1% that really just don't like needles. And I've seen, you know, women on like the Facebook forums, the IVF Facebook forums that are like, I hated it, you know, but most everybody really likes acupuncture. There aren't any contraindications that I know of. Some breast cancer survivors who have had mastectomies on, you know, one side, you know, and their doctors have said like no inserted needles, you know, on the arms. That would be the only contraindication that I know of. But then, you know, we can treat further down the legs and down the, you know, down the belly with their doctor's, you know, approval, as long as their doctor says that it's okay.
Got it. Okay. And then as far as I know that sometimes when it comes to like paying for acupuncture, some people do have like insurance coverage for it. They can submit to their medical plan. But for people that don't have the insurance coverage, on average, like roughly how much is a session?
You know, for somebody who specializes in fertility, you're going to pay a little bit more. And, you know, somebody in private practice, you'll pay a little bit more. So anywhere, you know, depending on the part of the country and how much how much we're paying, how much the practitioner is paying in rent, you know, anywhere from, I would say, you know, $70 to $120 would be kind of the average. I think you'll probably pay more and, you know, in your part of the country in New York City than we would, you know, here in Texas. So it just kind of depends. You know, fertility, it would be, you know, for people going through IVF, it does help to have a fertility acupuncturist because we kind of know like what they're going through. You know, if you're looking for somebody who specializes in fertility, I would like, you know, do a deep dive into some websites. You know, my website says fertility all over the place, you know, but But I have colleagues just down the road that specialize in pain. And so they're not really going to know what Follistim and Minipure and like what your calendar is and like what a retrieval is and what a, we don't learn that in acupuncture school. That's been an additional study for me over the past 8 years, almost 8 years. And so, my dear friend who specializes in pain knows the meridians that flow through the pelvic area, can do acupuncture for fertility. Absolutely. Can knows how to kind of, influence the kidney, spleen, and liver meridians, which are so important in Chinese medicine for fertility and reproduction. But they're not going to really know like what an IUI is versus what an IVF cycle is, and so those, if you want somebody who's on your team that like knows what you're talking about, I would definitely go and do a deep dive on some websites. Ask your doctor, because again, a lot of reproductive RE clinics, a lot of IVF clinics have acupuncturists that they refer to or may know people. I think every single doctor in this town has my cards, ask your OBs, I think you'll probably be able to find in more of the populated, parts of the country, you'll be able to find fertility specialists. If you're in rural Texas, if you're in Abilene, it's going to be harder to find somebody who specializes in fertility as opposed to somebody living in Austin, or Houston or San Antonio.
Yeah, that totally makes sense. So yeah, those are some good tips. So like look online for someone that specializes in fertility/IVF acupuncture, ask your doctor at the fertility clinic or your OBGYN, because they might have someone to refer you to. And then besides that, is there any, like, let's say someone for some reason they're not able to find something in their area, or just in general, are there any credentials people should be looking for or licenses when it comes to choosing an acupuncturist? Like how's that kind of regulated?
Well, all acupuncturists we go to school it's a 4-year master's program. And so we take national board exams for acupuncture. In Texas, we have to be certified in herbs as well. So we take our herbal board, an herbal board exam. And we study biomedicine extensively, Western medicine extensively. And so, look for the initials LAC, which is licensed acupuncturist, which is our initials on the ends. There are chiropractors and PTs that can go through a 100-hour course and call themselves acupuncturists, which is not really a good idea because they don't really know what they're doing. We, went through 1,000 clinical hours in the student clinic before we were able to graduate. So, licensed acupuncturists have extensive training in how the body works and how to safely needle, because there are acupuncture points that are right here, and guess what's right down here is a lung. Pneumothorax is a thing, so you do want somebody who has been trained in needling. And so yes, look for LAC, look for gosh, what are our other ones? Anyway, look for LAC, licensed acupuncturist.
That's super helpful. Thank you. So look for licensed acupuncturists when you're trying to choose someone. Okay, great. And then besides that, I remember last time we were talking, you mentioned that sometimes some of your patients that come to you will ask more about like lifestyle modifications or maybe supplements they might want to take. Like, tell me a little bit about that.
Absolutely. I highly recommend, promoting a really clean diet before, like preferably 3 months before you start fertility treatments. Avoid processed foods. There's the saying, you are what you eat. If you're existing on lean cuisines for lunch every day, that's processed food, and that's chemical laden, really taking a really deep dive into your diet practices and doing something along the lines of a Whole30, where you're really reducing gluten, you're really reducing sugar, you're really eating a lot of fruits and vegetables to really increase that antioxidant intake into your body, which are, antioxidants protect our DNA. They are cellular protective. They promote cellular energy. They promote the health of mitochondria. So really, really getting super clean with your diet is so, so, so important. Vitamins, yes, absolutely. You should, I really don't like drugstore prenatals because our supplement industry is not regulated in this country. You really want a good quality prenatal. There are lots of other supplements that can kind of increase mitochondria function in the cells, things like CoQ10, things like N-acetylcysteine. So there's a whole lot of supplements that we can recommend. I actually did a whole website about it called supplementsforivf.com, just because people would just kind of come in and, yes, I'm taking the grocery store brand of prenatal. I'm like, no, you can do so much better for not a whole lot of more money, and so really, finding the best quality vitamins that you can put in your body. You definitely want a good high quality prenatal for both partners. Male partners need to be on supplementation as well. I highly recommend both partners being on good, clean diets. Alcohol, not great for fertility. Marijuana, not great for fertility. There's plenty of studies, on both of those. Just really cleaning up your lifestyle. If you're going to pay $20,000 to have a baby, let's increase your fertility potential as much as we can and get really healthy before you go through a retrieval.
That totally makes sense. And especially what you said about the male partner as well. Like, it's important for them to pay attention, because sometimes the issue is that there's a male factor in fertility, and that's true in 30% of cases, it's male factor alone, but then in another 30%, it's combined, it's male and female infertility. So super important for them as well. Do you ever see men for acupuncture for the purposes of fertility? Oh, you do?
Absolutely. Yes, absolutely. It's they don't have a uterine artery, but they have arteries to their testicles. Absolutely, I see male partners. And I think it's important. And because men are stressed too, and and tend to kind of hold it in a little bit, more. And so really, it increases the sperm, the health of the sperm as well. Blood flow is always a good thing. Circulation is always a good thing. There are plenty of acupuncture meridians that run, through the pelvis. Doesn't matter male, female. So yes, male partners are more than welcome to come into my clinic.
Awesome. That's super good to know. I wasn't sure about that. Mm-hmm. And then I remember last time we were talking, you mentioned that along with acupuncture, there's something else called acupressure.
Yes. Oh, yes, yes, yes. Because somebody who doesn't have access to somebody like me, somebody in Abilene or rural Iowa, or some place that you have to drive 2 hours to find a fertility acupuncturist. I created an IVF acupressure course that you can activate your fertility points, and the fertility points that I needle every day from the comfort of your couch. And so acupuncture, our little acupuncture needles are lovely, and they are effective at really kind of getting into the exact point. But if you can also stimulate using pressure. You can stimulate these acupuncture points using pressure. And so I just wanted to, have everybody be able to activate their fertility acupuncture points, regardless of if they, have access to a fertility acupuncturist. So
That's amazing.
we will link those, and it's I have lessons for before stims, I have or before injections, I have lessons for and protocols for during injections. I have that pre and post, that Paulus study. I've got all of the points in those in the pre and the post, and then I have protocols for the 2-week wait, which are also good in pregnancy. So
Awesome. That's super good. We will definitely link that below, because that
you.
sounds like a great thing, especially that you can just do it from home if you don't have access, or if maybe like it's outside of your budget because you're already like shelling out so much money. Yeah.
Or if you're already seeing a fertility acupuncturist and you just want to continue the, acupressure care at home, it's really relaxing. Even just with stimulating, an acupressure point, and then just kind of relaxing, like you can feel endorphins. It's wild. You can kind of feel that acupressure or acupuncture kind of euphoria, even just with acupressure. And you can do it at your office. You can just kind of like activate, if you're sitting on the couch or at the office, you can totally just activate your little fertility points.
That's awesome. I actually might check that out myself, because I'm really curious to like experience it, because I'm a little bit afraid of needles. So
totally. I know.
Might give it a try with the acupressure first, because I feel like that's a good way for me to like get into acupuncture later on.
Well, and I also have lessons on like how exactly I mentioned a little earlier about like kidney, liver, spleen. I talk a lot about how Chinese medicine, like the philosophy of Chinese medicine and how it affects our fertility. And so, because it's so fascinating, like people are just so interested in it. Chinese medicine has been around for thousands of years, and influenced gynecology for thousands of years. So it's just a beautiful science. It's a lovely medicine. It's a lovely ancient medicine, and it's been, it's been around for a long time. So it must be doing something.
That's a good point. Or it would be gone by now. So tell us a little bit about your practice in general. Like, can anyone that's interested in trying to conceive, that's just trying naturally, can they see you? Do you only see IVF patients?
I see anyone trying to conceive, going through fertility treatments. I see women, in early pregnancy, in mid-pregnancy. I had one of my patients who I saw during her IVF came in the other day, and she's at 30 weeks now and is having some sciatic pain. But yeah, and then everybody just kind of needs to calm. But when you're trying to conceive naturally, acupuncture is really good at kind of regulating hormones. It's really good. It's kind of good at it's really good at calming stress. And cortisol, that stress hormone, if you're living in fight or flight, if your sympathetic nervous system is activated all the time because of work, job stress, fertility stress, if you're living in that stress, it will mess with your periods, and so getting that blood flow into, the uterus and ovaries, if you're trying to conceive naturally, it's really good at regulating hormones. And increasing your fertility potential. So yes, I see women like throughout their fertility journey, and also just like women who aren't trying to conceive, who just like have painful periods because of endometriosis, or don't have periods because of polycystic ovarian syndrome. Like anybody who wants to kind of regulate their female health, their periods, acupuncture is a great candidate for helping to do that.
That's good to know. So it's not only for people that are trying to get pregnant, like anyone who's basically paying attention to their health enough to know that they need to help improve it can come see you.
Yes, exactly. And like I said, we're all in Texas, at least we're all registered herbalists. We've all taken our herbal board, and there are some ancient, amazing formulas for gynecology that are traditional Chinese herbal formulas that are really good at supporting women's health. So, if you're interested in finding an herbalist, that's available to people who, are trying to get help with their periods, because, a typical period, you don't have to live in pain. I think women, typically a lot of people are running around in pain because periods are painful, and you don't have to live like that. And there's, great blood moving herbs. There are great great pain relieving herbs. Acupuncture is amazing at relieving pain. So it's, you don't have to suffer. There are herbs and needles for that.
That's a really good point because it is still March, so it's still Endometriosis Awareness Month.
Right.
And it just blows my mind how there are so many women out there walking around thinking that painful periods are normal and that there's nothing that they need to do about it because it's just normal. So there's not anything wrong. So definitely like anyone who's having like painful periods should definitely like see your physician, get checked out,
Yes.
see your acupuncturist, because it's actually not normal. And usually the time to diagnosis for people with endometriosis is about 7 years on average. So people are waiting too long because there's not enough information out there. So I agree with you.
Agreed. It's so important. Our reproductive systems, don't have to harm us.
Exactly. They're our friends.
Yes, they are.
Awesome. Well, this was amazing. So tell us, are you located in San Antonio? That's where your practice is?
Yes, I'm in San Antonio. Yes, I'm in San Antonio. I work with all the fertility clinics. We've got five IVF clinics here in town, and I work with patients from all of them. I work with, OB patients as well. And yes, it's lovely. I started my career in Austin, but made the journey just down I-35 an hour or so. About 5 years ago. So it's a great, San Antonio is a great town.
Yeah, it is. I went to the ASRM that happened in San Antonio a few years back.
Yes,
yeah.
I was there
Were
too.
You there?
Yes,
Oh my
God.
Was. Crazy. Yeah. I was presenting some research for what was it? There were so many. I think it was genetics when it comes to males with azospermia. We were looking at variants. Yeah, it was really fun. It was really interesting.
Gosh,
but yeah, so San Antonio is great. It's very beautiful there.
It is. Well, and hopefully we'll have an ASRM this year, maybe we'll see. It's usually in October. So we'll see. Hopefully we can have a conference, because that was amazing. I loved that conference.
I know, it's so fun. You like meet so many amazing people.
I know.
But yeah, and then finally, is there I'll put all your contact information down below for anyone that wants to contact you or has questions for you. But do you want to shout out anything right now for like how people can get to you?
Sure. I have both a Facebook and Instagram handle called IVF Acupressure. You can find me there. You can download. I have 8 tips for 8 tips to increase IVF success, or something like that, from the IVF Acupuncturist on supplementsforivf.com, and you can download that freebie. And then you can DM me at any point. If you have any questions about fertility acupuncture. I am all about acupuncture for the masses. Everybody needs needles because they help so much. So if you have, and also I just want all y'all to have babies. I want everybody to get knocked up, and again have the best platform to go into your fertility treatments. And so yes, absolutely reach out to me by all means. I'm here to help, and this has just been so delightful to talk to you. I love it, and I love what you're doing with FertilitySpace.
Thank you. Well,
yes.
Thank you, Melsa. I so appreciate this. Like, thank you for talking to us. Like, you have unveiled so much about acupuncture for me. So thanks for being on.
You got it. Thank you so much, Claire. Appreciate it.